Well, we see a lot of diabetics in my practice. It's probably about 50% of our practice, and the statistics are striking. I took engineering calculus in college, so I can tell you that statistics usually fascinates me. And there are about 70,000 diabetic amputations a year in this country. And about 60,000 non-diabetic amputations. And unfortunately, 90% of those diabetic amputations can be prevented. So unfortunately, most of the time in my practice, if I get a call from the emergency room, it's usually a diabetic that needs some kind of an amputation, partial amputation. And most of the patients that actually come and see us on a regular basis every 10 weeks, we really rarely ever have to amputate because they see us, we take care of them, we assess their risk factors, and basically maybe 1 or 2 times a year I actually have to amputate somebody who is an existing patient. So statistics in my practice is striking as well. It is definitely a proof that going and seeing a podiatrist 5 times a year can make a difference of a lifetime. Well, I mean, a regular amputation that I see in my practice that is from the emergency room, you're looking at staying in the hospital for several weeks. You're looking at intravenous antibiotics to get rid of bone infection. It's extremely costly, about $60,000 it costs to amputate somebody's foot. And the most unfortunate statistics is that within 2 years, 40% of those patients die. So bottom line is, if I was a diabetic and I heard that statistics, I would have dedicated 5 visits a year to go and see my podiatrist instead of considering a huge bill from the hospital and missing part of my foot and taking a 40% chance of actually dying from an amputation. Americans have no idea that peripheral arterial disease is the #1 killer. You know, breast cancer, I'm a woman, so of course I go to all the runs, and you know, breast cancer is such a big deal in the United States. As a woman, I have a higher chance of dying of peripheral arterial disease, not even being a diabetic, than breast cancer. So when we see a diabetic in our office, we're not very typical podiatrists. We don't just cut your nails and tell you to come back in 9 weeks. Absolutely not. If this is the only type of care you need or you want, you should not see us. We are there to basically assess your risk factors, just like if you go to a cardiologist to assess the risk factors for your